Ajit, like always, a pleasure to welcome you. Thank you for being here.
My pleasure, my pleasure. I know we've been doing this for more than 15 years. The first time was 2006 at the TIE event, so great to keep reconnecting with you in some form or the other.
It's a compliment I'll take, but it also gives my age away. So,
Mine too.
so Ajit, you have been on this landscape for a long time, and you have seen technology evolve, bursts come out and go. But I think the current one that we are all talking about, AI and then Gen AI, is likely to stay and have a deeper impact than other technologies have had in the last 2 decades. So, question then is, how are you seeing this evolve from the perspective of an investor?
So look, if I rewind some 30 years or so, my PhD was in AI, and yet I remained a skeptic about use of AI in routine practice, especially in healthcare, for a very long time. In the last 5 years, I have changed that view significantly. So what changed? Number one, the amount of data available in public domain or publicly available healthcare data or easily accessible healthcare data, that has multiplied. Second, the computational power has gone down significantly. And third, I think the pandemic played an acceleration factor. It made us immediately aware how poor the access is, how ill-equipped we are in terms of providing uniform access. So there, AI can play a significant role. Now, of course, can AI beat an expert? In a true mathematical sense, it cannot. I mean, AI is simply learning an average of experts, so it cannot beat the expert. But can it gather the knowledge of an expert and bring it to a lesser expert or a non-expert or a community healthcare worker? Absolutely, yes. And those utilities or those use cases, if you will, they abound in diagnostics, they abound in mental health, and now more and more in drug discovery and drug design and the whole pharmaceutical value chain.
So let's take that segment then. Healthcare is very, very huge, very regulatory, very rigid. Innovation outside of its core domain doesn't come very easily. Adaptability is also very difficult. So it's going to be challenging working with the traditionalists there because it gets even more difficult for startups because they are very agile. So any lessons there?
No, absolutely. There was a director of NIH, the National Institute of Health. His name was Elias Zerhouni. I met him some 20 years ago, and he made a statement: everything that will be used in routine clinical practice 15 years from now is already working today. Okay, so that was a euphemism for it takes us 15 years to adopt. Now, will that change? Probably unlikely. There's a lot of factors. The regulation is only one factor. It also requires probably moving away or moving aside of one generation of physicians. The next generation would adopt things more easily. Now, it's not universally true. I mean, you have some very experienced physician adopting new technologies. So take all those factors in. The 15-year adoption cycle to get to the last clinic is not about to change. Okay? However, the early adoption period that used to be 6-7 years long, that becoming 2 years is much more likely. So I think the early adoption cycle will definitely accelerate. The full adoption in routine clinical practice is likely to remain slow or likely to remain longer. There'll be some exceptions to the rule. I mean, let's say we want to use a AI-based diagnostic technology in a village in Africa or in India or in Brazil, or for that matter in the United States. Now, if an AI system has a negative predictive value or NPV or of a positive predictive value, PPV, in the 90s, 91%, 92%, we'll say, oh my God, we have a 9% problem. And the question I ask is, what's the alternative today? Is almost like tossing a coin. So are we 40 points better than tossing a coin? Or are we going to lament about the 10 points compared to perfection? So the moment we're able to make that switch of mindset, the applications are just across the board. And for example, take a cervical cancer screening program run by the Tata Group or Tata Trust Group in India. They are using this routinely. And it's rather effective in the communities where we don't have access to an oncologist, for that matter, even a primary care physician.
Slight digress to vaccines. If pandemic hadn't happened, vaccine takes about 12-15 years to come to market. it happened so fast. So the skeptics are still skeptics. It is not the right thing to do, but everybody has taken it. So is this a one-off thing, or there was some real, urgent need that was there, and then people had to push this out?
Absolutely. No, so let's use AI, the topic we've been talking about, as a guide, as an analogy or a metaphor. AI technology has been there for 50 years. Why this sudden resurgence in the last 5 years? It's not because a lot of data was available only or computational power is inexpensive only. No, the underlying technologies, the thinking has been gradually percolating, developing for the last 5 decades, and now the perfect storm of events has finally happened. Okay? Now let's move back to the pandemic and the vaccine for COVID-19. So the COVID-like pathogens, they are not new. They have been known for a couple of decades. And the development of the underlying technologies, mRNA, has also been around for a few decades. I mean, for example, there's one unsung hero in this whole business. His name is Peter Cullis. He's a professor at the University of British Columbia, and he designed some sort of a scaffolding, think of it this way, that allows carrying this mRNA vaccine into the human body. That has been going on for 30 years. Had that not been there, ready and able to go, the mRNA vaccine would have no chance of being administered or developed that quickly. So I think it was a perfect storm. A lot of underlying technologies had been developed over the last at least 2 decades, if not more. And the pandemic, of course, did act as a catalyst. There's no question.
So now I'm switching gears to startups and the investment. Where do you think the good guys are coming from? Because as you know, everybody knows, startup is a very passionate game, but not everybody succeeds. It's a very hardcore business. So I'm trying to learn from you, what is your current breed of entrepreneurs you're investing with, and what are you looking for?
Absolutely. So look, in answering your question, I have to speak from a lens, which is an Artiman Lens. When it comes to healthcare, we started investing about a decade ago, and the thesis we wrote in 2011 was we will invest exclusively in diagnostics. In 2011, diagnostics was not a glamorous term. It was receiving very little investment, and it wasn't, within healthcare, it wasn't enjoying the attention it deserves. Now, imagine watching any television show that has to do with healthcare, whether it's Dr. House or ER or Grey's Anatomy. Very often, the question hinges on what's the diagnosis. If you can crack that code, the rest becomes very easy. And yet it was receiving very little investment. Now, in more, let's say, business terms, leave entertainment aside for a second, diagnostics is about 3% of the total healthcare expense. Only 3%. Yet it determines 80% of the expense downstream. 25x leverage. How often do you get those opportunities? So we made a very conscious judgment call to invest in diagnostics. Initially, we were called crazy, insanity. But obviously, when 2020 happened, it was pretty apparent that that bet was not wrong. So we've got a dozen odd investments in diagnostics. A couple of them have sort of died and moved on, but the rest are doing rather well. And now each one of them has an added AI angle, has an added analytics angle, because what is diagnostics doing at the end? It's a sensor that generates some data coming out of your metabolism. And to analyze that data, it can be done by humans, can also be done by analytics, can be done by AI systems, or a combination of those. So I'm seeing more and more AI and even generative AI coming into the science and art of diagnostics, and as a corollary into drug discovery.
It's always a pleasure. I mean, I can go on for another half hour talking to you, but time is always a constraint. Really appreciate you. It's been wonderful to reconnect with you. Thank you so much.
My pleasure as well. Thank you.